It seems like a pretty simple question, right? Which country actually has the best healthcare? We all hear stories, we see these rankings pop up online, but the answers, they always seem to be all over the map. So let's actually try to get to the bottom of it. Let's dig in and figure out what's really going on. So here it is. This is the exact question that kicked this whole thing off, posted on a popular online forum for expats. And it's a question thousands of people ask. Maybe you've even wondered about it yourself. It's really the core of what we're trying to unpack today. And right out of the gate, you get answers like this one. This person's experience in Spain? It felt amazing. And why? Because the system was so incredibly thorough, almost to an extreme. And you can imagine, when you're sick or scared, that kind of attention can feel really, really reassuring. But then, and you have to see this, the very same person had this to say about Denmark. Now, Denmark is another one of those countries that always scores super high on global healthcare lists. But for this user, it was a totally opposite experience. Dismissive, slow, just plain frustrating. So how? How can two top-rated systems feel so completely different to the exact same person? Well, that's the puzzle, isn't it? Okay, to really find an answer, we've got to peel back the layers here. We're going to look at the two main blueprints for modern healthcare. Then we'll see what the data actually says about the trade-offs between them. We'll hear some of those stories from the ground. And then we're going to talk about something called the silver tsunami, a massive challenge that might just force us to ask a totally different question. All right, so as that whole Spain versus Denmark story shows, our personal experience is just everything. What feels like great, thorough care to me might feel like a huge waste of time and resources to you. And that's exactly why just asking who's the best is kind of an impossible question. We need a better way to think about this. It turns out most healthcare systems out there weren't just invented from scratch. Most of them are actually descendants of two original models, two foundational blueprints, you could say. They're often named after the guys who came up with them, Beveridge and Bismarck. Think of them as the two original family trees for universal healthcare. So let's break this down, because these are two really different ways of thinking about healthcare. On the left, you've got the Beveridge model. Think the UK's National Health Service. It's paid for out of general taxes, the government runs the whole show, and it famously uses your family doctor as a gatekeeper you have to go through to see a specialist. Its biggest weakness? It's always at risk of being underfunded by the government. Now, on the right, you have the Bismarck model. Think Germany or France. This one is funded by specific insurance premiums from workers and employers. It's less centralized, and you can often just go see a specialist directly. But the downside? It is much harder to keep costs under control. So we have these two big ideas, these two blueprints. And for decades, researchers have been crunching the numbers to see if one of them actually, works better than the other. It's kind of like a global competition for healthcare systems, but judged on cold, hard data. So let's get to the most important question first. Which system is better at actually keeping people healthy? Well, the data shows that the Bismarck-style systems, the SSI-ish ones, have a slight but really consistent advantage. People in those countries tend to have slightly lower mortality rates and live a little bit longer. It's not a huge blowout, but it's a trend that's held up for a long time. But when we start talking about money, the story completely flips. Here, the NHS-style systems are the clear winners, hands down. They are consistently cheaper, both in terms of how much is spent per person and as a slice of the whole economy. That centralized, state-run structure really gives them a big leg up when it comes to controlling costs. Okay, but the last piece of this puzzle is just, how do people feel about the system they live in? And wow, this is where the more expensive Bismarck systems win by a mile. You've got about 2/3 of people in those countries saying they're satisfied, compared to only about half in the NHS countries. That is a huge difference in public opinion. So here we are. This is the big takeaway. The data shows a really fundamental trade-off. Do you want a system that's cheaper and better at controlling costs? Or do you want a system that gets slightly better health outcomes and keeps people a lot happier, but it's going to cost you more? At the end of the day, it seems like no one has figured out how to have it. That big picture data is super useful. It tells us what is happening, but it doesn't really tell us why. Like, why are people so much less happy with the cheaper systems? To get that, you have to zoom back in and listen to the stories from people who are actually trying to use them every day. So remember that gatekeeper thing we mentioned about the NHS model? In theory, it makes a lot of sense, right? It's a way to manage the system efficiently to make sure specialists aren't overwhelmed. But in practice, well, for the patient, it can feel less like a gateway and more like a wall. And this This is what that wall can feel like. This user talking about Canada's NHS-style system just perfectly captures that frustration. The entire system is built around you having a family doctor. But what if you can't get one? What if no one in your city is taking new patients? Well, then you're basically locked out of seeing any specialist. You can see how that would drive satisfaction way, way down. Okay, now let's flip back to the other side, the Bismarck, or SSH systems. As we saw in the data, their big Achilles heel is cost. The very thing that gives patients more choice, that less centralized structure, also makes it a real headache to try and control spending. But again, this system-level problem doesn't always match the individual experience. This person is talking about Kaiser, which is an integrated system in the US. They had a life-and-death emergency, a 4-day stay in the ICU, and the bill at the end was pretty reasonable. And when a system, even one that's expensive overall, works perfectly for you in a moment of crisis, yeah, you're going to think it's the best thing on earth. So we've got this fascinating debate between these two classic models. But here's the thing. A brand new, absolutely enormous problem is coming for all of them. It's a challenge so big it's going to stress every single healthcare system to its absolute breaking point, no matter how it's designed. People are calling it the silver tsunami. Just look at this number for a second. In high-income countries, the cost of healthcare just for people over 85 is projected to jump by as much as 44% in the next 10 years. This isn't just about having more older people. It's about having more very old people who naturally have much more complex and much more expensive health problems. And here's the other half of that scary equation. This table shows you how many working-age people there are to financially support each retiree. And it's shrinking fast. In France, it's about to drop below 2 workers per retiree. In Japan, it's already at a shocking 1.6. So you have fewer workers trying to pay for the exploding costs of a much larger elderly population. That is a recipe for a massive crisis. So what's the answer? How does any system survive this? Well, experts say it's going to take huge, fundamental changes. We're talking about scaling up technology like AI to make things more efficient, shifting the focus from just living longer to increasing our health span, the number of years we live in good health. We'll have to totally rethink housing and communities to support our oldest citizens, and we have to figure out how to train and attract the millions and millions of new caregivers we're going to need. And all of this brings us right back to the beginning. We started out trying to figure out which country has a great healthcare system, based on the models we've had for the last century. But this new reality, it really suggests we've been asking the wrong question all along. One of the papers we read put it so perfectly. They called this whole debate a beauty contest between dinosaurs. I mean, think about it. The Bismarck and Beveridge models, they were brilliant for the 20th century, but they were designed for a totally different world with a totally different population structure. This global aging crisis, it's the asteroid, and these old models just might not be built to survive the impact. So the goalposts have totally moved. The most important question isn't who had the best system in the past anymore. It's who can build the most resilient system for the future. The real challenge for every single country is to adapt, to take the lessons from the past and build something new, something that can actually handle the incredible pressures that are coming. And it leaves you wondering, how will ours measure up?